Welcome back, everybody, to an exciting segment of the Late Night Show with Dr. Kojo. This is a doubleheader tonight. We have two exciting streams, and to kick things off, we have a very special guest here tonight who's going to share her story. Like me, she has ADHD. I can't wait for you all to get to know her. And before we do this, as we always do every time we stream, I want you all to go ahead and use the comment section to let me know your name and where you're streaming from, or where you're watching from. Actually, I'm streaming and y'all are watching and interacting, and this is a live event. Normally, I stream from Los Angeles, California. I'm streaming today from my little brother setup in Augusta, Georgia. So we are on the East Coast tonight, and we're having equally as a good night. It's been a rainy day here on the East Coast, and I'm not used to rain. I'm used to a lot of sunshine. So it's been an adjustment, but it's good to have the rain, and it's good to have you all here today. Austin is the OG. Austin, how are you doing? Austin is from Missouri. I know that, because Austin is amazing. Then we have Gabby. Gabby, how are you doing? It's good to see you. Gabby's checking in from YouTube. Keep in mind, we are streaming live on Facebook, YouTube, LinkedIn. Believe it or not, you can actually stream on LinkedIn. I just recently found this out. We're streaming on LinkedIn. We're streaming on Twitch as well. We don't have the biggest community on Twitch, but we do stream on Twitch. And we're also streaming live on TikTok. So you can follow us along on five platforms. Doing great. Thank you. Austin, it's always amazing to have you in here. Austin's one of the OGs. Austin is always promoting the book, and I really appreciate Austin's attention. Thank you so much. We have Robin from Kansas City. Robin, how are you doing? So we have a Kansas City person. So two Missouri people and a Georgia person. Our guest is also from the Midwest. So if you're from the Midwest, tonight's your night. We see people joining in on TikTok. Alexis on TikTok is checking in from North Carolina. Okay, so some East Coast folks. And then we have, let me see, get my stream set up right. Ashley from Alaska. Ashley, we are happy to have you here. We are happy to have everybody here tonight. Jessica from Northern Virginia. Okay, so we have a audience all across the U.S. We do have an international audience. Somebody in here will pop up and say that they're from Australia or something like that very shortly. Beth from Pensacola, Florida. We have Michelle from Texas. Michelle, how are you doing? Beth, how are you doing? It's really nice to have you. Jerry on TikTok, thank you very much. I appreciate you. Fox checking in from Indiana. Looking forward to this from the Pacific Northwest. By hearing and hearing by has become a YouTube OG, so it's always great to have you here. So tonight we're talking about ADHD and trauma. And one of the things that I enjoy looking at on the internet is I like listening to people who have stories that are similar to mine, but also individuals who have different stories. And I love it when people are transparent and they're open and honest. And I gravitate towards that type of content because it makes me feel better about who I am. And then, I'll be speaking at the ADHD International Conference in Anaheim, and that's mid-November. And my topic is going to be eliminating shame and implementing a system. These are things that I've done to make myself feel so much better. And our next guest is somebody who has had a lot of success, a lot of triumph in her life. And she's had her fair share of trauma like all of us. So I'm very excited to have her on. And let me see what the chat is saying. Lucky Tabby Kitten had an awesome doctor's appointment. That's what we like to hear. The first love of the show. That's what we like to hear. Probably the oldest. Robin, you don't have to share us your age. You can keep it confidential, but there's no age limit here. There's no age limit here on this stream. We can all run for president. Brooke from Ohio, how are you doing? Q&A. Yes, so Brittany, we will have a Q&A time after I'm done talking to our guest. And hopefully she's, able and willing to answer questions. I know she probably will, but let's go ahead and bring her in here and get things going. So our guest is Dr. Tosin Odunsi. Let me get her in here and let her talk to the people.
Hi.
Doc, how are you doing?
I'm good. How are you? Thanks for having me.
Thank you for being patient with me. And, it's an ADHD live stream, so we never really start on time.
But no problem. I was hoping so because I was doing my PM routine. I was like, oh, shoot, I got to do it before coming on here, else it'll throw off my whole routine. So I'm glad it started later.
And you mentioned routine. Before you tell us who you are, can you just talk about, because we like going backwards here, your nighttime routine? How long have
Sure.
you had it, and what does it consist of?
It's taken me a while to get here. So I have, like a lot of people, several alarms on my phone. And I have an alarm that starts at between 7 and 7:30 depending on the season. So depending on if it's before daylight savings or after. So I
Uh,
try to go to sleep earlier in the fall winter time because I do have seasonal affective. So I try to
uh,
not be exposed to a lot of darkness. So I try to go to sleep
wow.
earlier. And then right now in the summertime, I stay up a little bit later. So I go to sleep maybe half an hour later. Um, it's a long list and I don't do everything, but they signal to my brain, okay, you got to shut down because I've been a functional insomniac for a long time. And now I'm since the diagnosis in 2022, I've been able to sleep, and I think it's because of this routine. So it's yeah, I get good sleep. So it starts off with okay, the 7 o'clock or 7:30 alarm goes off. That's reminding me to eat in case I
Okay.
forgot to eat all day
Uh,
because I
okay.
do take medication, and sometimes it's like
Suppressed
7 o'clock and it registers or my I live with my parents, so they'll ask, oh, shoti jeon in Yoruba and ask if I ate.
Ah,
And it's like, did I eat? Oh yeah. So that 7 o'clock alarm is in case I haven't eaten to tell me to eat. And if I did eat, then this is the dinner time. So
got
that's
it.
number one. Then number two is dancing because I love to just dance the day away. It's something I've been doing since residency. That
Okay.
was part of my routine during my training where I just like to shake off the day and
Hmm.
just like leave the hospital at the hospital or clinic or whatever I did for the day. Do a dance. It could be 5 minutes, it could be an hour. So
Okay.
I'll just do that. And I allot 3 hours for my PM routine, but it doesn't have to take 3 hours. I just am very strict about it in terms of blocking off that time. Um, then the next thing is like lighting a scented candle. So I have a candle here and I use a candle warmer now because there have been times where I've left the candle unattended and gone to work. So I got a warmer. So I
Goodness.
hit that so that there's the scent of something warm and something nice. Then
Ah,
I take a warm shower.
it's
For
brilliant.
some reason it resets my thermostat. I don't know if it's a me thing, but it gets me all cozy and warm to go to bed. And then what's next? Mm, oh, I should just look on my thing, shouldn't I?
Yeah, that's quite elaborate.
Yeah, it's actually on my calendar as a standing event. So I should actually just pull it up. Oh,
Ah,
yeah. So melatonin first, eat
okay.
dinner, scented candle, dance, warm shower, review the next day to make sure I didn't forget that there's a meeting or something.
That's key.
So last night I was like, is this thing at 6, 7, 8? I didn't remember. So I review I review to for the next day. Then I lay out my clothes because I feel like I'm always rushing out the door. Then I hydrate because I typically forget to drink water. And then there's an alarm that goes off to head to bed and another alarm for lights out.
Ah,
And then
wow.
within an hour of that, I usually doze off. So that's why it's set for 3 hours so that I
Got it.
can be asleep by 11:30, and
Mm,
then wake up around between 6 and 6:30.
gotcha. Wow. And Chandel, yeah. So Brittany, thank you so much. You answered Chandel's question, but we're talking with Dr. Tosin, who is a doctor who lives with ADHD and trauma, and she was going over her nighttime routine. It looks like you just jumped in, so this is also the perfect time for Dr. Tosin to also introduce herself and let the people know a little bit more about you.
Okay. I'm Dr. Tosin Odunsi, and I'm an OBGYN, board certified OBGYN physician who is in Chicago. And I've pretty much had whatever you can encounter, like whatever category, I've had that in terms of healing. So that's why this topic is about trauma. And my case was I became board certified, had all these challenges. And then after I became board certified, I got my diagnosis because pretty much I couldn't cope anymore. I went through a bunch of life transitions and additional responsibilities and was like, I can't do this anymore. And none of the coping strategies I had were working anymore. And I was behind on like more than usual, the executive functioning, the administrative tasks. And I had actually taken like a learning disability test during residency and it came back negative, but they didn't test for ADHD. And
Uh,
the only reason why I was thinking it is because I met other physicians who had ADHD, and they were talking about their symptoms. I was like, but I
mm,
did well, quote unquote. I made it. So how do I have this thing? And then I took the test, and it was unequivocal that I had it.
and it's funny. So we do this little game here on the live stream. And every time I do it, we can play a game right now. So
Yeah.
anybody who's watching, if you've been diagnosed later in life, or if you've been diagnosed with ADHD, drop the age in the chat that you were diagnosed, and I'll click that as I asked Dr. Tosin. So Dr. Tosin, how old were you when you were diagnosed? If you don't mind sharing.
I was 35.
35. Right. And
Hmm.
it's remarkable how, because this is a condition that more than likely you're born with, how you can go your whole life without this thing being caught, but also be able to excel and get through medical school and to be in residency. It looks like the pandemic was maybe the only on the coffin that just maybe pushed you to where it's like, all right, we just can't cope. But why do you think your diagnosis was missed for so many years?
Um, so number one, I think culture plays a large role in this, and you probably know this, but I'm Nigerian, and I what is ADHD? Anything mental health is just like, okay, what's that? And
Mhm.
our culture, there's a lot of, okay, just like don't claim that thing.
Yeah.
You can pray it away. Like it's not a real diagnosis, things like that. And over time, my parents have understood a bit more of what's going on. I kind of stopped explaining at this point. It's more of I tell people what I need because I'm tired.
Yeah.
Like I
Yeah.
can't I can't explain everything, but platforms like this, I think that's why it's wonderful because you can feel seen, you can feel heard, you can feel like, oh yeah, that's my sister, that's my brother, just in a different way. And we all kind of process or go through life with similar experiences. So looking back, I was the daydreamer, and we've
Mm,
seen through research that women are more likely to have the inattentive type where they're not disruptive in class. I was actually very obedient,
mm,
people pleaser, and quiet, and wasn't disruptive at all, but
wow.
was a daydreamer. And I, for that testing, I had to ask my mom and probe a little bit like, oh, how was I as a child? And she would point out experiences with my grandma, like, you would take forever to lotion your
Mm,
foot.
mm,
And one of the things that my ADHD coach slash therapist had me do, one of the exercises was to time each thing that I was doing in
yeah.
the morning so I could create my AM routine so that it actually was reflective of how long I was taking. It takes me 8 minutes to lotion my body. What
And-
I'm doing during that time, I can't tell you. So is it lotioning? I don't know. It just takes a long time for me to do things, and I don't register time the same way as
mm,
my sisters. I have two younger sisters.
yeah, the time blindness, the time just escapes you. And to answer Shannon's question, it appears as if women do typically get diagnosed later in life. That's from what I've seen and what I've read. And what's in my mind, it could also be the delay between tasks, because like in addition to making these videos, I've had to do so much research, primarily to help me set up my life, But I've learned that the when you're neurodivergent, specifically ADHD, when you go from task to task, there's a
Hmm.
delay in between each task that's longer than that of
Right.
a neurotypical person. So now I'm curious, before you lotion yourself, what do you do before you lotion yourself? If you need to,
I get out the shower, and
okay.
then okay, the next step is lotioning, and it could be 30 minutes later and I'm not lotioned. I really don't know what I'm doing.
Hmm.
I wish
And-
I had some sort of big big brother situation to be like, this is exactly what you're doing.
yeah.
Maybe I'll go on my phone, or maybe I'm daydreaming, or maybe I'm like going through my day. I don't know. I can't tell you.
Yeah, no, that's how it is for a lot of people, and time escapes you so fast. And I'm looking here on TikTok. Someone says, "Yes, I've done this as well." Bonnie saying the same. And somebody on TikTok, the diagnoses came in. Somebody was 48, 32, 31, 21, 25. Yeah, this is definitely a thing.
Mhm.
Wanda is glad that she tuned in. Laura said it took her 3 hours to vacuum two average size carpets. Daydreaming is so soothing.
Mhm.
Yeah, and these are all things that it's almost like a club that you feel like you've been initiated into because you finally can have experiences that people can relate to, but you've been going through it your whole life and you probably didn't know what it was. Did you have an idea of what this was when you're younger, or did you just go through
No,
negative
I
self talk?
didn't. I didn't know what ADHD was until maybe college, but I thought it was the boy that's hyperactive. And then in medical school, we kind of touched on it. Residency, I didn't even consider it at all. And then other things from my childhood and even through my training was test taking. It was
Yeah,
very difficult. I remember for high school calculus, my mom had to talk to the teacher, and we were just trying to figure out what was going on and if I needed extra time. That just, it didn't help. So we know that ADHD is, if you're interested in something, then you'll probably do better in it.
right.
If it's calculus, physics, chemistry,
Oh, physics.
and you need physics and chemistry to take the MCAT, you need
Yeah,
um, those things that I equate more to engineering. I think the engineering mind is different from mine. So anything like math, it's not my forte, or
mm.
chemistry, it's not my forte. So I struggled with that. But biology, that was my jam. So
It's probably why you were able to get so far in your medical training because you were naturally, captivated by biology.
yeah,
Potential.
I've been wanting to be a doctor since I was 3, and
Uh,
was pretty set on that.
Got it. And because I feel like because you wanted to be a doctor and you had your mindset on it, it was easier to get things done up until normally when people get diagnosed later in life, there's some type of life event or something that happens where it's like, all right, we can't keep living this way anymore. And
Hmm.
like you referred to, all the coping skills no longer work. And can you take us through that time period in your life?
Sure.
Leilani, what's
Sure. So there was a time period where things were difficult, but I was still undiagnosed. So I had to retake a couple, actually all of my board exams, at least twice. And then I finished or was in my last week of my first year of residency, OBGYN residency. And then my husband passed away suddenly. So that, if I had to describe one pivotal moment in my life, that would be it, because your foundation is just shaken. And I'm a believer too. So it's like, okay, I don't actually understand what's going on. And a lot of my identity was wrapped in, okay, I'm a doctor, physician, and also a wife. So once that identity is taken away, I feel like a lot of the things that were working were not, and I had to rebuild them.
yeah,
So I can't say I did well. I think if that didn't happen, maybe things would have gone differently. Maybe I wouldn't have had to take my step 3 exam 4 times because I had PTSD and was grieving the loss of my husband. So I can't say for certain, but I know that it masked the symptoms of ADHD at the time because I
Wow.
had anxiety, depression, PTSD, and at that time I took the test for a learning disability because my whole life I thought, wow, are you dumb? Like what's going on? There's got to be something going on. And then that test came back as normal IQ and also a delay with retention of information because of the depression. So that's how I was able to get extra time on that exam. And then I passed that time. And then I also got more time for the board certification exam. Did
Okay.
I? No, I didn't. I passed on the first try, but at that time I learned some, yeah, I know.
It's coping skills.
Learned some coping skills because I made sure I got a tutor. Like I started studying a year in advance when my colleagues would have studied for 2, 3 months. So I
Oh,
went like really, really, really hard. I overdid it, and that's fine. I just was tired of failing exams. So
oh
I
wow.
don't know if that answered your question.
No, no,
Oh,
no, go ahead.
the second point of like where I got diagnosed and where everything was blowing up was I finished my minimally invasive GYN surgery fellowship and was going through a life transition and then immediately started another a job out of fellowship, and it involved traveling back and forth between Chicago and Florida. So I had no routine. I was
Wow.
working, sleep was an issue because I could work 4 24-hour shifts in a week. I was like, let me just do this. Let me try this. And that's ADHD too. Like, let
Yeah.
me just try.
I think
Let
I
me
think I
try.
can. Yeah.
Let me try only sleeping 3 days out of 7 days. Let me try that. That's a good idea. It's not. Don't ever do that. So I
Yeah.
was doing that for 6 months and couldn't keep up with administrative tasks and wasn't sleeping because I'd fly home and then have to go right back. So I wasn't recovering. I wasn't getting enough rest at all. And then I'm Googling, like, what's wrong with me? I can't focus. I can't do anything. All I'm doing, like, I'm in a different type of survival mode than being a widow. Being a
Right.
widow was just, I just have to focus on residency and getting out of here. Right. Now
Hmm.
I have my other, like my business stuff and a full-time job. So that basically everything, just all my coping strategies I had for residency weren't working or fellowship weren't working anymore.
Got it. Okay. All right. And what's your opinion on this question here? And after that, I do want to circle back and talk about ADHD and grief in a second. But for caffeine, what does caffeine do for you? Does it make you fall asleep? Does it get you activated?
So I am mostly energy drink free
Okay.
now. June 26th, 2022 was my last energy drink until recently.
Okay.
Okay. But before that, I was drinking 2 Bang energy drinks a day to stay awake. And
Wow.
they each have 300 milligrams of caffeine in them. So I was drinking like 600 milligrams of caffeine a day. Cup of coffee is what, 80, 82. And
Yeah.
this is just so I could stay awake and focus so that for 12
Wow.
hours.
Is this before like ADHD meds or
Correct.
during or oh
This
oh,
is
oh
before self-medicating.
got you.
So
Got
now, because I have the PM routine, my residency, I was sleeping average 3 4 hours a night.
it.
Okay. Compared to now, I'm I go hard for these routines. I
Uh,
go so hard for these routines because I need like 6 7 hours, and I still have that little bit of a slump around between 2 to 5 p.m.
yeah. Yeah.
So
It's hard to stay up.
that might be the time I get a caffeinated tea. I
Mm,
also use caffeine gum, which has half the caffeine of a cup of coffee. That's been great because as a surgeon, I don't want to be in the bathroom if I'm operating or have to leave. So the gum has been great. This is real talk, right?
I didn't even think about that. You have to be able to do your job for hours on end. So it would be good for you to not fall asleep during surgery.
Correct.
That would not be a good.
You don't want me falling asleep during a case.
It's like, oh
But
no.
the adrenaline helps too. It was more so,
Yeah.
okay, it's the afternoon. I've already rounded. Um, maybe I have some things to do for the business
Hmm.
and I'm sleepy. But I'm also at the hospital on a 24-hour shift. So I use the caffeine to help me work
Right.
or be efficient. There's something with being like productivity with us, I think, and
Hmm.
always doing something.
Yeah.
It's very hard for me to sit still. So I use that to, it's a toxic trait for me to be productive while I'm working.
It's difficult, and I think the adrenaline from surgery, I think, is the thing that prevents you, to answer Laura's question, from sleeping. Because sometimes I do see this thing where even stimulants make you sleep when you have ADHD, and the caffeine has this paradoxical effect. But I think when, like, because you have ADHD, that sense of urgency and that adrenaline that comes from, I have to stay awake so that way we don't mess up grandma's hip replacement or so on and so forth. Like that will keep you awake regardless, right?
Yeah. I don't fall asleep while a patient's actively open.
Yeah,
I'm paying attention, but it's more so, okay, I have to get through this 24-hour shift.
yeah.
I could take a nap, and I've given myself more grace to not try to work while I'm at work. Because for a long time, I was like, oh, I'm just working. There's some downtime. Let me do something else when I have some downtime. But I've learned to, yeah, take a nap.
Good.
Take a nap during that 2 to 5 p.m. window. You know yourself. You know that the babies are going to come at 3 o'clock in the morning. So just take the nap so you
Uh,
can make it through the rest of the 24-hour shift. So,
that makes sense. So, pattern recognition. Let me see. Someone on TikTok said, "Until I got treated, I drank caffeine all the time. Meds helped so much with productivity. Terrible at test taking. Yeah, a lot of similar things that you mentioned in your story.
mhm.
And go circling back to grief, um, with ADHD, our relationship with rejection and grief can be prolonged, delayed, and just overall frustrating. So, can you talk to me about, this the grief journey? Because it's something that I don't think it really ever ends. But
Yeah. So it
yeah,
definitely doesn't end. So husband passed in 2015, in June 2015, and
sorry to hear that.
I thank you. I took a month off and then I went straight back into full force. So it took me 5 years to finish a 4-year residency, and there were moments where, so I did have a therapist during residency, but I spent the bulk of the time talking about, okay, I got to get through residency. It wasn't a lot about my late husband. I actually didn't start dealing with that until maybe 2022.
That makes sense. Like,
2021, and you kind of push things down. But the thing about ADHD that I learned is it's almost a diagnosis of exclusion. So I needed to stabilize my life first
yeah,
and treat the anxiety, treat the depression, and get stable with that. And then the ADHD symptoms were still showing up. So
yeah,
in times of stability, there was still a lack of focus. There was distractibility, there was the insomnia, the things like that. It just doesn't go away. Versus if you're grieving, and all of my Wisters, the widows, they know that 3 o'clock in the morning is the time that you're going to be up. So you have these competing things that can look like ADHD, and
yeah,
that may actually be why 75% of women don't even know they have ADHD
yeah.
because they have either big trauma or little trauma. The big trauma, so like if I had a big trauma in childhood, maybe it would have presented earlier. But I had this big trauma that presented later, and along the way I've developed these coping strategies, and they got me to a certain point, and then something happens and I can't cope anymore. When
Yeah.
you have little tiny cuts, so little trauma, um, I feel like that might be hard to get through as well,
Yeah.
for women. So the reason why I'm distinguishing between big trauma and little trauma is the big trauma in childhood, that person may be diagnosed sooner than somebody who has these tiny cuts. Okay, I failed an exam, great. All I do is think I'm dumb. Okay, let's work around that feeling of feeling dumb until 2018, which was my situation. But it's not registering that it could be this other thing that's going on. It's like,
Right.
oh, okay, it's an intelligence thing, but it wasn't.
Mm. And with grief and also with grief and rejection and relationships, how have you progressed in that journey, and where did you say that you are now?
Um, I still have an issue with rejection and also the emotional side. So the medication, what I've learned is it helps with the focus, it
Mhm.
helps with productivity, but it doesn't help with the rejection sensitivity. It doesn't help
Mm,
with the emotional dysregulation.
okay.
And I know this firsthand because I've had situations where it's like, oh, I thought the meds was supposed to take care of everything. So that's where
Yeah.
my ADHD coach and therapist come in so that
Got
I
it.
can like be in the moment and say and recognize what's happening and tell people what I need in the moment. Like I feel myself escalating.
Yeah.
I need to like I may say it more firm than this. I need a break.
Hmm.
I didn't know I could take a break from a situation. So in the past, I would just escalate and escalate and escalate because I would want a resolution. But
Oh,
I've learned that,
yeah.
okay, how about we come back and meet, regardless of who it is, whether it's romantic or family, friends,
Mhm.
let's take a beat and let's come back. And it's mostly for me. Let's come back with a level head and work towards this goal of resolution as
Mm.
opposed to saying things I don't mean or that's the main thing. Cause I'm very blunt,
Right, right. So direct and to the point.
very direct and to the
Okay.
point. And sometimes that doesn't work.
And are you okay with people being direct and straight up,
I
like
prefer that.
you prefer? Okay, okay.
I
And
prefer that. I have a hard time reading between the lines. I
mhm,
just want people like tell me what you want,
mhm.
what you really, really want. Oh, I just did that thing.
Is that a Spice Girl song?
Yes, it is. I'm like classic right now. Maybe I don't know. Maybe
And,
because it's late, the meds have worn off. All
and,
the masking is gone at this point.
Uh, I feel that it's easier for us who are neurodivergent to just have straightforward communication, because a
Hmm.
lot of neurodivergence is differences in communication, which can break down relationships, friendships, business partnerships. It can get you fired from your job. People don't realize how important communication is.
Yes,
Effective communication goes a long way.
absolutely. I
Goes a
had
long way.
to force myself to be a better communicator in residency. So one example would be, okay, I'm going to postpartum and I wouldn't tell people where I was going, but I was doing something work related, like to take out stitches or, excuse me, take out staples. And people were like, where'd you go? So just closing the loop of communication, of announcing, I'm going over to postpartum to take out the staples, those like contact, those cues, those social cues, I was just going to do my job and then coming right back. But I had to learn over the course of residency, no, you actually have to tell everybody what you're doing. So now I've taken that as an attending physician to just let people know. And it's better to over communicate. I'm not saying overshare, I'm just saying over communicate.
Okay. Important distinction. Important
Correct.
distinction, because the oversharing is its own issue.
I have a problem with that.
Oversharing.
Okay.
Okay, How have you been able to like work on oversharing and cutting back on that? If you've been able to make progress on oversharing,
I have made progress, but I also think the oversharing, people see it as transparency. And
right?
that's why they resonate with my platform, because I built or made this Instagram page for 2 months before my husband passed,
Oh, wow.
and it has been a form of healing for me. I'm a writer,
That's awesome.
and if the captions are where the gems are. I put the post just as a placeholder because Instagram wants you to put a post, but everything that is meaningful is going to be in the caption. So since 2015, I've been writing and writing and writing, and maybe that's been my way of coping. Um, yeah, I'll say it's been my therapy. It's been my way of getting through this grief journey,
Oh,
and it's oversharing, and now I'm at a point where it's like, actually, I don't need to share everything.
yeah,
I have my core pillars. Those are the things that I always talk about. But there are some things that I keep private because I do believe I don't have to share everything that's going on with me.
yeah.
And I like that feeling of, ooh, I got something going on, you don't know.
Yeah, but it's hard to keep it a secret. You're like, man, I could tell these
It's
people.
so hard. Like, I have stuff going on that I keep having to, it's not time. Like, just
Yeah,
close your mouth.
it's,
Close your
it's
mouth.
it's really hard, especially when you're like, I'm like, I just want to show people like what I'm doing. Like I'm not,
Mhm.
I got this going on. And Leilani, we'll get to that. That's a really good question. Leilani, hold that thought because there's two or three questions in there I want to address. This is a good question. But the you mentioned oversharing. What are some things that you learned that are things that you should keep to yourself as somebody with ADHD?
Okay.
Tough
Rom-
question.
Romantic relationships,
Yeah.
I do not invite opinions during early stages. I'm single. For those out there, just playing. I do not invite opinions
There's
because
three relationship categories, by the way. Like you may not have known
we'll
this.
we'll focus on romantic.
Okay, but there's
Okay.
relationship, single, and then single, single. Single, single is
Single.
no
Oh, what's
roster.
that? What's single single?
Single, single is no roster. It means that if you go to Jacksonville, you don't have a guy waiting on you. If you go to Kansas City, there's not like that one guy. If
Oh, okay.
you go to San Diego, there's not that one person who's been waiting to date you for the last 7 years.
Okay, first of all, my my view of the world is as somebody who got married when I was 21.
Mm-hmm.
So I don't even know what that means. To me, it's
Oh,
just,
okay, okay, yeah. Point.
and I'm also very old school. Like, I believe in courting, blah, 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 blah. So these different categories, I don't actually understand. So sure, I'm single, single. I'm single, single since I just learned that
uh,
terminology.
you
Um,
have to distinguish it nowadays because dating is its own thing nowadays.
got it. Noted. And that's probably why I'm single, single, because I don't know all the terminology.
Got it.
Okay. So there's the romantic relationships that I keep private because I don't want anyone influencing how I process the situation or being in my business about it. And then also, if it doesn't work out, then yeah.
Yeah, and I like that because this whole thing where people, you meet somebody and uh, like there's nothing wrong with like dating two, three people in a year or like four, five. Like there's nothing wrong with that. But when you make everything public on Instagram, it's like, oh, I had the best time with Brianna. Brianna is amazing, and then you break up, delete all the photos. Man, Sandra was the best girl of all time. Post, delete the photos. Kelly was, and then for girls, like, oh, Brian and Jake and Tyler and Todd and Thomas. It's like maybe people are dating more than you, but because you're putting it out there, you're opening yourself up to these, judgments from people,
Mhm.
and
Right.
probably affecting the actual relationship. That could be why some
Hmm.
of the relationships are not working out, because you have all
Right.
these monitoring spirits,
Oh yeah.
and opinions, and also it influences how you think too. And if you're a people pleaser, like your mind is going all these different directions.
Right. Exactly.
Yeah.
So I'm not a people pleaser anymore. I just really protect
Mm,
what's going on up here. And because I have 1,000 thoughts going on all the time, I don't want the additional thoughts of other people in my mind whirling around. So it's more of a protection thing, protecting my energy, protecting my
yeah.
peace, protecting my joy, and also so I can enjoy whatever season I'm in at the time. I
Yeah.
also I could say the same thing about being single. Like I don't necessarily have to make my whole platform about being single, but there is a peace and a joy that comes with being single and exploring that. And the
A lot
time
of
I have by myself to actually mature and grow and figure out what I like and what I don't like.
Yeah. No, it's very liberating, and I think a lot of us with ADHD, sometimes being impulsive, sometimes moving faster than we'd like to move. Sometimes it's helpful to be able to just sit back and pause and enjoy that moment of solitude and being single, where we can just kind of clear our brain. Like I'm on a new single journey, and it's blowing my mind. Is truly blowing my mind. Like I'm seeing things that I've never seen before.
Mhm.
And, like when you go fast, you don't catch things.
Mhm.
It's good to be in
Yeah,
a
you'll notice more red flags when you slow down.
yeah.
But I
Mm.
haven't figured out, have you figured out how to slow down, or are you just more intentional about it and more like, okay, you're doing too much.
I've only figured out one way to like slow down or depedestalize somebody, and the only way that I know to depedestalize somebody is getting with another girl, which is not a good, is not bad.
Got it.
You know, it's not a good way of coping. So now I'm having to spam calls. Relax. Now I'm having to like start all over, and put a certain emotion to how I'm feeling, and just find artificial ways of slowing down. Which the thing that helps me out the most is my platform and the things I'm involved in and making the content. Like
Hmm.
without the content and the things like the comedy things I'm pursuing, I think I would be in real deal trouble, because my brain
Right.
is naturally expensive. I want to go do all this stuff. I want to go date everybody, but because I have these things that are kind of keeping me in check, it like that's why I'm so grateful for my platform and all of this, because this brings me structure. It helps to depedestalize and not
Hmm.
put somebody on such a high standing, and then that's your everything, and then it can look like love bombing. So
Yeah.
I just get myself consumed with other things and go to the gym, and that seems to be almost as effective as getting up underneath somebody else.
I agree. Yeah. Just finding going with your other passions is
Right, right, because
definitely,
creative
that's what I
energy,
do.
that's what you do as well.
Because I'm not distracted, but my time is occupied with other things. It's like you literally have to be knocking at my door
Yeah,
to talk to me at this point.
yeah. So have you set up your romantic life like that on purpose,
I
to
think I'm just in this season of let me just build, let me
Mhm.
build, let me build, let me build. I'll socialize here and there and go out. This is Chicago, and it's summer in Chicago. It's lit.
Chicago, yeah,
So
Chicago's
so
nice.
there's a lot going on, but I don't want to fall into the trap of, oh, there's this person. I really want to just be intentional about it.
Yeah.
Um, so I socialize, but there are other priorities right now.
Yeah, that makes sense. And summertime shy is Chicago is a hell of a place. It's
It is.
maybe the best walkable city in the U.S. and the downtown is amazing. And I live in L.A., so I mean, I like LA, but
Hmm.
similar issues. Like it's a lot of lights and camera action, women here, and there's a lot of things going all at once. So if you don't ground yourself, you're gonna be in trouble, in
Right.
big trouble. So like it's forcing yourself to have to, you know, like be accountable to something. And I think your career and your creative energy, all that really does help. That really does help. Libby says my time is occupied with me being confused about occupied time. Libby, what's up? This is hilarious. And somebody asked your specialties. Is it OBGYN? Is that correct?
Correct. Yeah.
Okay. So Sarah, I think Sarah hopped in a little bit late. And the power of being able to say no. How did you learn how to say no, Doc? Or is that still something you're working through, like learning how to tell people
It's
no?
okay. So it's very easy for me to say no. It's the way I say no that I'm working on because I'll just be like, no.
Oh, okay.
Okay. So before I would try to do everything for everyone, I think my perspective now is much different than the average person. I compare everything to life and death.
Okay.
So there are a lot of things that are urgent and unimportant. There are a lot of things that are not urgent and unimportant. There are a lot of things that are urgent and important. And then whatever that last quadrant is of that square.
Hmm.
Um, so I focus on things that are important. So
Okay.
if I can pause for a second and think. So I've learned to use the phrase, "Oh, let me think about that." Especially when it comes to work, everything is urgent,
Yeah.
okay? And I'm not talking about with patient care. I'm talking about administration. They need it now. And I was like, "Well,
Everything
I
is
don't even check my emails at all." So they know in the medical staff office, if they need something now, they need to call Dr. Odunsi because email will always be my Achilles. I've gotten better at doing
no
it.
hard.
So that's a boundary. Like you can't just email urgent.
Hmm.
And like I'm not sitting at my computer. I'm taking care of patients. I'm in clinic.
Hmm.
So setting boundaries with people and
Yeah.
expectations with people has been a huge thing. So if I say no, now the tone's better. I have more vocabulary other than the word no. And I know we say no is a complete sentence, but I do like to soften the blow a bit. So let's say I'm invited to something and I don't have the bandwidth for it. It's not that there's something against the person. It's just, oh, unfortunately, I'm not able to make it. Thank you so much for the
Yeah.
invite. Like I'll spin it with a positive as opposed to either ignoring or saying, nope,
Right.
not it, not doing it.
Yeah. That's helpful. Having that tact of the outcome is still the same. The intention is still I can't be there tonight at 8, but like thank you for thinking of me. Thank you for considering me.
Mhm.
So that way people don't be like, damn, this person's an asshole. Yeah.
Right. I don't want to not be invited. I still want to be invited. I still want to be included. I still want to be considered.
Mm-hmm.
But as we know, our energy level can fluctuate and can drop very quickly.
Yeah.
So, my go to phrase when I'm socializing with people is it's going to be a game time decision, guys. And they know that, okay, we will plan. And if she doesn't come, she already warned us that it's
Right.
a game time decision. And there's certain things I have to do before I go out. If it's starting at 10 p.m., absolutely not
Yeah.
on a weekday.
This is way too late. So they
I can't hang anymore, and I don't know if it's because I'm in my late 30s or what, or because I'm so like I stand for my my sleep and my PM routine.
I can hang either. 10 p.m. is too late for me. Too
Yeah,
late.
so I love daytime activities, and like, all right, we're wrapping up at 8. Go home, jump into my PM routine, make an abridged version, hop in the shower. All right, scent a candle, lights out, let's go.
Yeah. And then you have the wherewithal to be yourself the next day.
Mm-hmm.
Yeah.
Exactly. Exactly.
And We normally do a water break, which we'll do, and I came ready. I always have me some water. Uh,
Same.
also, if you're okay with it, are you okay with taking a couple of questions?
I am. I
Okay.
did want to also make a statement that
Mhm.
ADHD in women, it's not studied well enough, and it's especially not studied as it relates to hormonal changes. I wanted to make sure I said that because I'm an OBGYN. So estrogen, what's been shown is that estrogen can affect ADHD. So if there's a sudden drop of estrogen, the symptoms may be worse. So that's why some people may notice their symptoms get worse around the time of the month. Okay.
Mm,
And then we don't have studies on the menstrual cycle. We don't have studies on pregnancy. We don't have studies on perimenopause or menopause. And those are significant times where the hormone levels are fluctuating. So I wouldn't be surprised if with ADHD, and just anecdotally, because I'm not an ADHD specialist, a lot of people, their ADHD symptoms may worsen during certain times of the month if they have regular periods. And then in pregnancy, because it's a high estrogen state, their ADHD symptoms may get better during that time. So I just wanted to point that out.
yeah. No, thank you for clarifying that. That's actually a very common question. I'm looking at the response in the chat, and like looking through my DMs. This is a question I get like once every 2.5 months or so. So can you repeat that one more time for
Sure.
the people in the back, and then
Sure.
we'll do the water
So
break.
ADHD is likely, again, I'm not a researcher, I'm not an expert, but the estrogen ADHD link, estrogen is a dopamine modulator, and that's the hormone that's typically lacking or low in ADHD. So there are different points in a woman's life where the hormones are going to fluctuate. Number one, when you're having your menstrual cycle, the estrogen level goes up and down during the cycle. So during those times when it's low, you may experience more symptoms. Again, in pregnancy, because it's a high estrogen level, you might actually feel like I can conquer the world because now you have more estrogen circulating. And then also postpartum, you have this sudden drop of estrogen.
Yeah.
So you might have worse ADHD. So a good time, meaning not a good time, a time where women may get diagnosed is now I'm trying to do motherhood and I have this life transition and this low estrogen state right now,
Wow.
um, coupled with maybe postpartum depression. So the estrogen state really affects different phases of life. So also perimenopause and menopause. So that may be an additional point where women are diagnosed like, okay, everything worked out. I got through motherhood. Now I'm going through another phase of life. And oh no, I'm 50 something years old and I don't remember, like, I can't focus at all. Nothing works anymore.
Wow. And this is such a game changer. It just blows your mind
Mm-hmm.
because like you're noticing to yourself all these things and you're like, how come nobody told me this? Or how like why is nobody talking about this? Which makes you feel even crazier for lack of a better term.
Mm-hmm. And it might make, let's say you're a first time mom, you don't know you have ADHD, or you do have ADHD and you're like, well, before I had the baby, I was coping just fine. And then there's this added pressure, and women have more roles and things they have to take care of in addition to working outside the home if they choose to do so.
Hmm.
And just all these other pressures that are placed on them that can throw off this routine that we're desperately trying to avoid, but we need.
Yeah. Well, fortunately and unfortunately, but we need it. We
We
definitely
need
need
it.
it.
We
All right. And
need it.
let's do the water break and then let's answer Leilani's question. This is a really good question right here. And I'll break it into a couple of parts. So the water break, this gives us a chance to drink some water. As you know, a lot of us are in that
Cheers.
version. We forget to drink water. So big cheers, y'all.
Clink, clink, clink. Oh, you do the whole thing.
Hmm.
Okay. Okay.
I
I
go
need to
hard in the
step my
paint.
game up.
It means I was just dehydrated all day because I really needed it. Oh, and Angelique says this is so clarifying. I went back for my master's 3 months postpartum because I felt so inept at motherhood. I ran back to what I did well. Yeah, it
Hmm.
explains what you mentioned earlier, and you mentioned earlier in the live stream about the emotional dysregulation with the meds. And Leilani is asking here. Uh, Her son is on 54 of Concerta, and noticed that he seems more emotionally stable. And she's thinking about going on meds for the first time since she was 10. For what I was told, it made her a zombie of a person. So my take on this is because ADHD is a condition that makes it hard for you to regulate your mood and regulate your attention, then the things that help you with your ADHD can help you do those things. And I
Correct.
read a survey somewhere that said that 89% of people said the thing that's most helpful for them with ADHD is the medications, which makes sense to me because I feel like in psychiatry, ADHD meds are the most effective meds that we have. It's not
Hmm.
like insulin that works for diabetics, because antidepressants take a month to work. They may not work. They may work. People have to do genetic testing. The mood stabilizers, you have to go through Depakote and then Lamictal, and then now you found lithium. So it's
Hmm.
in psychiatry, it's not as linear. But with ADHD, the meds are. I believe ADHD is the most treatable psychiatric condition, and I've heard people say things that have gone from my medications help me uh like even my mood out to my medications make me not want to cheat.
Hmm.
So I do believe that there's an effect on your mood
Yeah.
with the meds, but I don't think that it's an automatic thing, like Dr.
Right.
said, because just because and like sometimes the meds will work, or sometimes it makes you like hyper focus on the wrong thing. So
Hmm.
it's not like a one size fits all, but I do think that
Correct.
it can target one of the two. In my personal opinion, I think that that's helpful. Dr. Tosin, what do you think about that?
I will say that so I actually asked my parents several months after I started the medication, what have you noticed about me? And my dad said, well, you seem calmer.
Mm,
And it may be a couple things that were happening. I can focus, so I'm not anxious about not focusing. I'm
okay.
getting stuff done during the day, so I'm not staying up at night. So
Mm,
therefore my sleep is better. So therefore, maybe I can actually wake up to work out. So
mm,
it's kind
mm,
of this snowball effect
yeah,
where you're doing all these other wellness things
yeah,
and you're able to actually complete things. So now your mental health is a little bit better. So
yeah,
you're less emotionally labile, is how
yeah,
I see it. I feel like I can tackle more with the medication. I don't take it every day, but because that confidence is boosted, it just
yeah,
has this downstream effect to other things. Like if I do these things, I'm getting 8 hours of sleep, and
yeah.
that feels great.
Yeah. Yeah, and that makes sense. I'm happy you touched on that point because because confidence comes from repeated self achievement. When you're able to get things done, whether you're relying on your Vyvanse, Adderall, Concerta, now you know that you can get these things done. You can be done at 5 o'clock instead of 1 a.m. You can get
Mhm.
sleep, and the next day you can feel like yourself. And then now all of a
Mhm.
sudden we feel good about ourselves, and we're not as emotionally,
Mhm.
labile because we know that we're productive.
Right. And
Yeah.
I was a zombie during residency
Okay.
because I was sleeping 3, 4 hours a day.
Uh,
I'm harping on the sleep part because 70 to 80% of ADHDers have some sort of sleep issue. I
mm,
really think that is the ticket. Like,
yeah,
if you can nail down the sleep, your life is going
yeah,
to be dramatically different. And whatever you have to do, like, get aggressive with those routines. I know you don't want to do it. I don't want a routine. I want to be like my dad who can fall asleep in 5 minutes. I would love that. And he's also a physician too. I would love to just come home and fall asleep. But we have to do the extra work. Just like with other stuff, we have to do extra effort to be like the neurotypicals.
Yeah, but I'm happy you cheated on sleep because that's why I think ADHD and bipolar are like cousins because there are two conditions where your sleep means more than it does for the neurotypical person. Like you don't want to think you can cheat sleep. Like,
Correct.
and if you do, you'll learn the hard way, and then you'll come back and say, "All right, I need to get some sleep." All right, okay. Libby's question here: before period starts, worst ever crying, ice packing, breast pain, nauseous. Wait, with period, 10 out of 10 pain. And I know Libby has ADHD as well. What's your take on this question, Doctor T?
So this looks like premenstrual symptoms.
Mm,
These are all classic
premenstrual
symptoms. So before your period comes, this sounds like classic PMS.
okay.
So the pain, so she's specifically asking why the 10 out of 10 pain.
Mm-hmm.
I cannot say that I know what that is because she's not my patient and I haven't examined her. I haven't taken a
Right.
history. However, if I'm to do a differential of what the pain could be, and as it's related to the period, so some things that you can consider would be: is there a cyst that's there that kind of ruptured? There are cysts. So each month, we're going to do a little biology. Each month, you're going to release an egg from a little sac. So we have these little water balloons inside our ovaries. Is this ADHD too?
But that's
So
just
this is how I explain it to my patients. So we have these water balloons that are inside our ovaries. Each water balloon houses the egg. The egg isn't just sitting there hanging out by itself. It's inside this protective, it's called a follicle, but the term I use for my patients is a water balloon. Each month you release a water balloon and then the egg comes out. If the sperm is there, it'll fertilize and maybe lead to a pregnancy. If not, you can have like a hangover follicle. So that water balloon typically gets reabsorbed by the body, but you could have a hangover follicle that burst and it's just kind of hanging out. That could be what might cause some of the pain. It could also be that ovulation process as well.
mm,
Okay. Because it's the water balloon is opening up. It could be endometriosis. That's something else that a lot of women have. That's also underfunded, under researched. I could go on and on about women's health and how we need funding for research. So the thing that women need to understand is that pain is a common thing, but it's not normal. So I would investigate this further.
okay. I
It's
like that.
probably PMS, but as an OBGYN, my job is to rule out the big scary things so
Mm,
that I can reassure you that that's not what's going on. This sounds like PMS, but I would actually track my periods and track the symptoms. But because they're all happening at the same time, it's probably because of those hormonal shifts. And
mm.
that sudden drop of the hormones is causing that.
And while we're on the topic, I know with ADHD, there is a correlation between ADHD and PMDD. What's the difference between PMS and PMDD?
PMDD is the depression part and more of the mood changes. So it's not just, man, I have my period or I'm about to get my period and I don't feel good. Your mood actually changes. You might go into like a depressive episode.
Yeah, it's like the evil cousin of PMS.
Yeah, it's more severe.
Yeah. Wow. And let me see. Depo 6 months. Depo. So
Yeah, weight gain.
Depo has like a impact on mood regulation or mood dysregulation.
Can we put this one back, the question back up? Let's see. So, number one, what's my opinion on Depo? It just depends on the conversation with the patient and what's the indication. So when I counsel my patients on a form of contraception, it's what are the goals for using this? So is it a convenience thing, like you with the depot you get an injection every 3 months versus a pill, you take a pill every single day, versus an IUD, which also has a hormone in it, but it sits inside the uterus and stays there for 5 years. And then there are the non-hormonal IUDs that can stay for 10 years. Then there's the Nexplanon, which goes inside the arm or underneath the skin of the arm, and that's 3 years. So it depends on the indication. My opinion of it depends on the indication and the patient. And then the next part is the gaining 60 pounds in 6 months, and then switch to the Nexplanon. So that's the implant
Arm.
contraception in the arm. But at the point of damage was done. Oh, with the weight gain. And I haven't been able to get rid of the weight no matter what I've tried, even while in the military and in a profession where I was up and moving. Okay. Also made my symptoms so bad. And I'm assuming symptoms meaning ADHD symptoms. Maybe.
Yeah.
Okay. So my approach to this, if you're off the depot, would be to ask if she'd been worked up for PCOS,
Okay.
and also to get imaging of the ovaries to see if she has. So PCOS is polycystic ovarian syndrome, and it's a misnomer. I don't actually support the name of it, because it's not that you have multiple cysts. Remember we talked about the water balloons? It's that you have multiple water balloons. So it really should be called polyfollicle. So you have a lot of follicles, more than what we'd expect in the ovary. So each month you bring up several follicles. In the PCOS patient, they're going to have a lot of follicles there. Okay. So I
Wow.
would also ask about other things that are happening. Does she have acne? Does she have signs of having elevated androgens or testosterone, meaning hair growth? Does she have symptoms of insulin resistance? So I can look at the back of the neck and see, does she have, it's called acanthosis nigricans, where there's darkening of the back of the neck. Does that tell me she's having some sort of insulin resistance? So I'd probe and ask those questions too. Like, were your periods regular before you started the depot? Were they regular at all? Were you on any other form of contraception? And just get this history. We like to ask period history a lot.
Mm.
So ultrasound last February because of bad pain, and everything came back normal. So I would go to the OB/GYN and see if they can test for PCOS if you haven't. And
And,
see. They
and
may not have to repeat the ultrasound.
this makes me think that, like we had these arguments like who has the worst, women or men, and and ADHD mental illness can be a great equalizer, but there's so much that women have to deal with between postpartum, that whole peripartum period. Then you have your hormones and your cycle, and then PCOS and then PMDD, which I've seen no correlation between the two of those and ADHD. And a lot of women are doing this unmedicated, undiagnosed, and is leading to people are losing jobs, relationships are ending. Uh, so much is happening, and you can't explain what's going on with yourself.
Mm-hmm.
Wow, wow, wow.
Yeah, and struggling with depression too, because the expectation of a woman is that they can balance it all.
Right.
And you have a full-time job and managing the home. I'm specifically talking about the mothers here.
Okay.
I think I think it's unfair.
You
And
think
then
so?
let's throw ADHD on top of that. Like, that is not fair at all.
No, it's a lot. Like it's It's a lot for women, and the expectations. Yeah, like you have to be a mom and a working mom, and then you have to deal with your own. My goodness, like I'm humbled by how difficult it can be. I didn't realize. Every now and then when we have these conversations, I realize, but this can be difficult. This can be very difficult. Wow. And I did have one more question for you, Dr. T. So earlier you mentioned that when you lost your husband, you had to deal with the difference in or like the identity issue. You saw yourself as I'm a physician or I'm a wife, and there's all these expectations, and then you have the cultural thing too, which
Mm-hmm.
this the West African, that's its own beast right there. So
Mm-hmm.
where do you root your identity in now, given your insight into ADHD and pattern recognition and knowing yourself?
Yeah. So initially I thought, okay, now my identity is I'm a widow. Okay. And then I finished residency and I decided I'm actually not going to identify with anything. They're all bits and pieces of me, but they don't identify who I am. And I am a believer, and my identity is in Christ. And the way that I approach life now is I tell myself the truth of who I am. And you don't have to be a believer to do this. You tell yourself the opposite of what your mind actually wants to think, which is, oh, I'm stupid. Oh, why can't I do this thing? And comparing myself to other people. You have to verbalize the opposite of what your thoughts are telling you because they're usually not the truth. So, for those of you who are out there who are constantly having this loop, I called it a hell loop.
Mm-hmm.
I still call it a hell loop. And sometimes, if I'm not getting enough rest, if I'm sick, if I'm not going to church, I can fall into this trap of, dang, I'm failing at life. Like, I'm not winning right now. And you can get into this hell loop of thoughts. And you have to, well, you don't have to do anything, but I started verbalizing as I'm scrubbing for surgery the truth of who I am. I deserve to be here. I'm smart. And it took 4 years of doing that. Remember, I mentioned a long time ago, I didn't feel smart until 2018.
Wow.
That was a year before I finished residency. That was when I decided I'm smart.
Yeah.
I'm intelligent. I deserve to be here. And I just kept repeating those things over and over again, whether it was during rounds, whether it was scrubbing for surgery. And I still do that now. Because I'll say a prayer before going to the OR and just reassure myself that I've been trained, I have the knowledge. I'm not actually different from my colleague who passed the exams the first time. We're
Yeah.
all board certified, and even with those struggles, even with those test scores, it doesn't matter. We're all the same.
Hmm.
And the people who haven't struggled, I like a good story. And the
Yeah.
people who have a good story, I respect the people who coasted and did everything right. I respect them because yes, you are smart and you also deserve to be here. But I love a good underdog
Yeah.
story. I love a good, you came up from the ashes
Yeah.
and you just proved everybody wrong. I love stories like that. So when I'm
First.
mentoring, the way that I talk to my mentees is with this type of passion. Like, you got it. You like there's no question. You have everything within yourself to succeed and you deserve to be here. And I say it over and over again. So when they encounter Dr. Dempsey, when they go on my platform, when they go on my post, I'm saying the same stuff that I had to tell myself to get to this point of being like, nobody can tell me I'm not smart. Go away. Nobody can tell me I don't have grit. Nobody can tell me I don't have determination. Nobody can tell me that I shouldn't be here.
Yeah.
And now, because I've been saying it for 9 years,
Yeah.
it's easier for me to get out of those hell loops than before. Before it would be a 3 day, oh Lord, I gotta wallow for 3 days or wallow for a week and just ruminate. Now,
And your
all
thoughts.
right, couple hours and take a nap, girl. You're probably tired. Like I said, 3 times where I'm going to be in a hell loop. I'm tired. I'm sick. I haven't gone to church in a couple weeks. I need Jesus.
I need Jesus too. I think we all need Jesus. This is remarkable insight, and people have to realize that a lot of us are just kind of coming to our own and learn to like ourselves. And we've had years of the negative thoughts over and over and over. So you need years and years and years where you're pumping the positivity into your brain, the repetition over and over and over. And
Hmm.
we have to be kind to ourselves because we've taken our whole lives to get this realization that, oh wow, like I am smart. I am brilliant. I am good because of all those negative thoughts. And the negative thoughts and the that starts really young.
Hmm.
You learn that you can't, trust yourself. You can't rely on yourself. So once you take this active, like it's an intentional decision, because until you make that stand, people, and when you carry yourself like this, people look to just step on you.
Hmm.
Unfortunately, there's givers and takers in life, and a lot of us tend to be, you know, givers, and takers will gladly just take, and then you'll realize that boundaries are an essential life skill.
Yeah, it's the same as like how we were talking about my privacy when it comes to relationships. I don't want people feeding into my thoughts that I already have. So you
Yeah.
have to protect your thoughts with that kindness. So, what are you inputting?
Hmm.
And we can go into a whole social media thing. I started deleting people that I follow, because I realized that even that input,
Yeah.
as
Yeah.
benign as it is, even if I'm following comedy or things that make me laugh, I really had to go through who I'm following, because I hadn't done this declutter. And I know for us it's a little hard to declutter stuff, but I'm down to add like 6,669 people I was following since I created this account.
Hmm.
Now we are at maybe 1,800,
Wow.
because
Wow.
I realized I'm allowing too much stuff to
Yeah.
to cross my eyes.
Yeah.
And now I'm good with a good, like, someone who plays with slime, somebody who makes
Hmm.
things out of cake that looks real. It's mindless stuff that doesn't affect my emotions and doesn't affect my thoughts. So
Yeah.
I'm looking at more of that, more positive things, um, things that help me stay motivated as I'm pushing this business forward. And I'm doing small bits of executive functioning and telling myself, you can do it.
Yeah.
Don't tell yourself you cannot run a business. Don't tell yourself you can't do whatever you need to do to succeed, because there's so many ADHDers that are successful, and I've never met one that isn't brilliant. I haven't met one that doesn't have a zone of genius. I haven't met one of us who is like dominating. Like, they may even be undiagnosed, but there's nothing you can't do with ADHD. I just think it's having the wisdom to ask for help, know your limits, but don't you dare tell yourself you can't do something.
Yeah. It's very important, and the social media conversation around what we're allowing into our psyche is huge because, yeah, like maybe it's a Los Angeles thing, but you're overly inundated with so much out there that if you don't put up boundaries, it will swallow you. And it swallowed me before, but I'm gratefully at the place where, like you said, like every year in December, I go back and I probably should do it multiple times throughout the year. The late people, I don't want to see their content. I don't want to see this content. This is
Hmm.
negative. Anything that's negative is not allowed. No negative energy is allowed. And I can tell if people come to my house and the energy is negative. Like I'm not gonna bring myself down to make you feel better.
Hmm.
Like I'll check on you. Are you good? You want some food? But I won't bring my energy down to meet
Right.
yours. And then often when you do that, that's the best way to actually help them
Hmm.
because they'll mirror you instead of bringing you down.
Exactly.
And because thoughts are powerful, and we like to perseverate on what's in our heads. Like if we're gonna have racing thoughts, we might as well have positive racing thoughts.
Mm-hmm.
Not the stuff that's telling us that we can't get things done. So I believe in saying that you can get things done, that you are smart, you are capable, you will do X, Y, and Z. You really have to tell yourself that you can do it, and then you go out and you do it. And a lot of things that are happening for me, I really um, like I'm starting to see that it came from a thought, and I put it into action, and then it happened. So I completely believe that. Libby, yeah, I don't mind people blocking people during election season. Like whatever you have to do for yourself, you have to do what you have to do for yourself. Because when you sometimes we say, oh, is this a social media post? I don't mind. I can mute the person, or I can like no, but the same thing you don't want to see somehow ends up on your For You page.
Yeah, the algorithm keeps showing me stuff even after I've blocked it. I
Right,
don't get it, but I'm gonna teach it.
right.
I'm determined to teach it what I want to see. So sometimes in my stories, I intentionally am messing up whoever is watching my stories algorithm. So I'll put the slime. I'll put the tiny miniature houses. I'm intentionally trying to mess up their feed to
Uh-huh.
put that in their algorithm. I don't know what this is about, but it's like a little experiment.
Okay, that's interesting. And like I know that with IG, like sometimes you have to like hit not interested in TikTok too. So I find myself hitting not interested on a lot of certain posts to not have it keep coming up.
Hmm.
And like I will just leave the
I
phone.
just learned about that. So a lot of the stuff that I'm saying, it's I learned in the last quarter.
Okay.
So that's why I'm doing this massive. All right, and I can tell which seasons I was in. Like, why are you following a bunch of interior decorators when you don't like doing that at
Mm,
all? Or DIY people, like you're not a DIY person. Or there's a point where I was following a bunch of skincare, or I don't know. I can tell what season I was in or what the hyper focus. I can tell what the hyper focus was because it'll lump
uh,
like it'll give you 50 at a time that you can unfollow. I was like,
right. You can't do all.
why was I in this phase? Like I was going hard in the gym, so I'm following like a bunch of bodybuilders. Why?
Mm, yeah,
So it's just not where I'm at anymore, but I can definitely see every single hyper focus that I had
yeah.
since 2015.
Wow, wow. And you can. I'm happy we touched on this because you can curate your feed to what you want. Like if
Mhm.
you get a high off of negative things, like everything is awful, everything is awful. Like there's certain posts where I see where it's like Hollywood is dying, the movie, and I'm like I can't. It's something about I love LA, but you have to find a way. And I think it's a LA or New York thing. You have to find a way to coexist within this space without
Mhm.
being swallowed up by the negative because
Right.
there's so much beauty around. But if you like allow yourself to say, "Oh, Hollywood is oh no, it's over for you," I'm gonna do my social media like my space that I've
Mhm.
created within the city is positive and it's healthy, and there's people who care about me, and there's non-transactional relationships, not
Right.
just let me keep you on tap. I might need you for this one thing, and then
Mhm.
like that doesn't make anybody feel good at all.
Mhm.
You'll feel like you're used.
Right.
Yeah. Curating that social media feed. Yeah, no, this was a great live. Uh, Black people and researched. Yeah, nothing is wrong with blocking people. Nothing is wrong with, and it comes from people pleasing. I figure out that it's better to just do it sooner than later.
Mhm.
Because whenever you do it, people will say, "Oh, so you never were riding with me in the first place," and then explain. Sometimes when you're explaining too much is a sign that you should just stop.
Yeah.
Too much explaining, like no more. When you get to the point where you no longer want to explain, it's like okay, yeah, whatever you
And
think.
I'm not spending as much time on social media too because it's like, okay, you can set your timer or the time. Sometimes I ignore it. And I've even put up other blockades like Instagram asked me if I want to take a break after 30 minutes. I set that up.
Oh.
I've also set up to where it goes into night mode or something from 8 p.m. to 8 a.m. so
Ah.
that it gives an additional, not hurdle, but it gives me a message saying, we advise that you log off Instagram. I was like, oh, okay, thanks. I,
Ah.
okay, I needed that cue because I'm down this rabbit hole of slime.
I'm gonna start doing that because I've started to read books again. Like I
Mhm.
don't even read books, it's all audio book. So like in order to read a book and focus on the book, I can't be on the phone.
Yeah.
So like putting up like blocks on TikTok, or some days I won't even be on the app, just because I need to clear my
Oops.
brain. Oh, you're good. It happens.
Uh-oh.
Did I lose you? I can see you.
Darn. Are we back? Are we back? Are we back? Can you hear
I
me?
see. Yeah. Can you see me? Can you hear me?
Oh no, I can't hear you.
Okay. Can you
My
see me?
10 p.m. alarm went off.
Okay. Well, we've been on for quite a while.
I
So
can't hear you though. Hold on.
okay. All right. Let me type it out. I'll
Should
type it.
I log out then log back in to
Uh.
reset whatever the audio is?
Uh. Yeah. Try
Okay,
that.
I'll do
Try
that.
that. Okay. No, I'm not writing with you from Idaho. Persons in Boise, Idaho, upset that Libby cut him off. Libby, you gotta do what you gotta do. We not the nonsense is healthy. Not is big healthy. Big healthy. Let all right, bring Dr. Tosin back in. Can you hear me? Good?
Yes,
Okay.
perfect.
Okay,
That was
awesome.
my PM alarm to wrap it up.
No. We are good to go. Like you brought a lot of value to the community. Thank you so much for coming on. And
Problem.
like it's good that we have these alarms because we can ramble on for
Oh
forever.
yeah,
So
absolutely.
all I have to say is thank you so much for coming on, and thank you for your time. And I'll get a copy of my book sent out to you when I get back to LA tomorrow.
Well, thank you.
Um, so yeah, I'll get that
Does
sent out.
anybody have any other questions? Because I'm okay staying on if anybody has any pressing questions.
Well, actually, we can bring it back instead of having to push your
Oh, true. Keep
yeah.
me up till 2 o'clock in the morning. I can
Right.
talk.
No,
I
no, no.
can talk.
I feel like I can stay up to 3 and still be okay. Oh,
Let's have a competition.
well, I don't think I lose, but I probably should lose that one. That's one that I probably should lose. Uh, last question: which doctor diagnosed you with ADHD? And then wrap it up.
Psychiatrist.
Psychiatrist. Okay.
Mhm.
So Laura, a psychiatrist normally does this, but also a PCP can do it as well. So yeah, a lot of people are expressing their gratitude in here.
Aw.
So thank you so much,
Thank you
Doctor.
for being here wherever you are. Thank you so much.
Yeah, and thank
Mhm.
you, community, for sticking through on this long line. Thank you so much. I appreciate you all. Laura, we got your question at the last second. So I'm going to end this stream right here. Thank you, everybody. Have a wonderful night.
Awesome. Good
And
night.
actually, hold up. We have to let people know where they can find you at. I almost
Oh,
forgot.
yeah. It's gonna be Life by Tosin on Instagram.
Tosin on Instagram. Is that the
Yes.
main place where you like for people to
Mm-hmm.
follow you at? Life by
Yes.
Tosin on IG. Yeah, time did fly, so it did mean that it
I
was.
know, it did fly.
So Life by Toast on Instagram is where you can follow her, and then do you have a link in the bio where people can see everything else that you're doing?
Sure.
Okay, all right. So Life by
Sure.
Toast, and Candace, the live stream will be available for playback. You can watch it on YouTube and on Facebook. So once again, thank you so much, everybody.
Awesome. Have a good night.
Good night.